guys, welcome back to my channel. My name is Zainab Olamide and thank you for watching my videos. Kindly subscribe if you are not subscribed to my channel, and thank you if you've subscribed and you are still following my video. I really appreciate it. Thank you. So hi, welcome guys. My name is Zainab Olamide. Welcome back to my channel, and today I'll be talking about health on a topic commonly known as lung cancer. Lung cancer is one of the most occurring type of cancer in the whole world currently, and it is among the top 3 most deadliest cancers in the world. The first one, which is the lung cancer itself, the second one, which is the breast cancer, and the third one, which is the colorectal cancer. Okay, so today I'll be talking about the lung cancer. And lung cancer, as it is said, it's a cancer that occurs within the lungs. So what is a cancer? A cancer is a type of cell that manipulates other cells and makes them dangerous to themselves. So when this kind of thing happens to our lungs, then which causes lung cancer. So lung cancer is majorly common to those who smoke. Why? This is because smoking has a content. So let me go there. Let me clip it. I'm still going to talk about that. How smoking causes lung cancer. Okay, so we have 2 types of cancer. We have the non-small cell cancer and we have the small cell cancer. The small cell cancer is not as common as the non-cell small cancer. So, as a matter of fact, cancer doesn't have a cause because it's idiopathic, but it has some predisposing factors like the risk factors. The most common risk factor, or let me say the first risk factor to ever mention is going to, for lung cancer, is going to be smoking. Yes, smoking is one of the most important thing that causes lung cancer. So also family history of lung cancer. We can also have the second-hand smoking in the sense that you don't smoke, but you live with people or live around people that smokes. So indirectly, you're smoking. I'm not saying it, but you are, yeah, because you are also inhaling the smoke to yourself indirectly, even though it is not a direct contact, but you are also still inhaling it. So you are predisposed to lung cancer. My sister or my brother. I see that. Okay, also you can also have exposure to toxins like chemicals. Maybe you work in a place where there is exposure to radioactive elements or some substances that are dangerous to our health. So this can predispose you to lung cancer. Okay, how are you going to know if a person has a lung cancer? We may not know. Yeah, how are you gonna know? You cannot know. Yeah, you may not know, because most people that has lung cancer, they don't know at the early stage because they don't show any symptoms. They only show symptoms whenever it is advanced. So when it is advanced, such a person can be coughing, like there can be a persistent cough that doesn't go, and that type of cough might be like, it might also collaborate with itself with you vomiting blood or coughing out blood, so which shows a good signs for lung cancer. But like I said, it doesn't show at the early stage, it only shows at the advanced stages. So also the person might have wheezing respiration, and anything else can occur. Okay, so how do smoking predispose an individual to cancer? This is how it happens. Let me break it down. Everybody talks about smoking causing cancer, but they don't tell you how it occurs. They don't really explain to you in a layman language for you to understand. So that's what I'm doing here. I'm bringing it down to our understanding. You know, like when you smoke, there is a substance in cigarettes. Oh, let me not say that. There's substance in the smoke that causes cancer. It's called carcinogen, and carcinogen is a substance that causes cancer. So while you smoke, you inhale the carcinogen into your lungs, and once this carcinogen gets into the lungs, they causes damages to the lining of the lungs, the endothelial layer. They causes damages to the lining of the lungs, thereby causing the lungs, like causing damage to the lungs, obviously. Yes. So when this kind of damage occurs, like almost every time you smoke, the number of times you smoke increases your chances of getting lung cancer. So if you do smoke like every day or every time, so then you know that you are pushing yourself to having lung cancer. I'm not saying that, but I'm still telling you. Okay. So this kind of damage occurring to the lungs, thereby once the exposure is more than required, then the lung cells started malfunctioning, and at the end of the day, it becomes a cancerous cell. Do we understand that? I think we do. Okay, so that is how smoking generally causes lung cancer. So how can we prevent this? We can prevent lung cancer in some ways, and some other ways too. It is kind of not so possible, but by doing the preventive method, they normally say prevention is better than cure, so which I don't see reason why we should not adopt that, even though it's not easy, our lifestyle have been used to it, but we can also try to bring it down and make things better. So firstly, definitely quit smoking. Yes, I'm serious. Yeah, I'm talking to you. You have to quit smoking. It's difficult, but you need to, like, it does a lot of damages to your body compared to the advantage. I don't know the euphoria you get, but I'm sorry, I have to tell you, you have to quit smoking. When you quit smoking, you leave yourself of chances of having lung cancer, and which is still better. I'm not saying 100%, but at least it's still better. You know that you cleared that area already. So, and also, don't smoke. You've not started smoking, but you see your friends smoking and you want to try it out. Please, my dear, don't try it out. They're trying danger, fire, because you don't want to burn your lungs. You don't want to cause yourself the kind of disease you never expected. And my dear brother or sister, cancer doesn't just stay in a position. They said it does something. It metastasizes. What did I mean? It moves from one place to the other, like it crawls to every part of the body. Every chances it gets to that particular part and ruin the part, make that part susceptible, make that part cancerous too, leading to another type of cancer. So what is the risk? Why going to smoke? Why did you want to smoke? So I don't see reason why you should do that for yourself. And also, as a second-hand smoker, you can try to move from people that you know that smokes, or change your environment, or try to go out whenever you see them smoking. Go out, receive some fresh air, allow the room to, like, expose the room to allow the smoke out before you get there. Like, don't stay in that kind of environment for the moment, so you don't be the second-hand smokers and exposing yourself to risks of getting lung cancer. So finally, there are some complications that can arise from lung cancer, which is you can have pleural effusion. Yes, what I mean by pleural effusion is when the fluid is entering into your lungs, and you know, when fluid is entering into your lungs, definitely is something that is not right. So, which is not normal. And also there can be sudden death, because cancer causes death at the end of the day, and there will be shortness of breath. But you know, when you don't breathe again, definitely going to die. So let me go to the treatment. Sorry, I am not coming accordingly. I'm talking as it comes to my mind. Okay. So treatment is based on the stages of the cancer, in the sense that we might be in the first stage, second stage, or the end stage. So let's I'm not going to define the treatment based on the stages. I'm just trying to explain that the treatment are based on stages, but I'm going to talk about the treatment generally. So treatment can be treated with drugs. There are some drugs that can be given to help prevent that kind of thing, like to prevent the complications, and also to maintain a well-being, and also to help you with your breathing. and other symptoms that you are exhibiting. And also chemotherapy, definitely it's a part of the drugs that are going to be given to you because it's cancer. Okay, so we have radiation therapy too, which can be given to you, and also we have surgery. Surgeries can be done to such an individual, and there's some procedures that can be done to, like thoracotomy can also be done on the patient. And finally, lifestyle in the sense that you can quit smoking, reduce smoking, or even abstain from smoking generally, and anything that has carcinogen in its compounds. So guys, that is all I have to say concerning lung cancer. I hope the video is educative, even though it's short, but at least it summarized every aspect that I wanted to cover. And thank you. Kindly like my video, subscribe to my channel. Please, I really need subscribers. Okay, thank you guys.